COVID-19 is changing the way we live our lives because it's affecting everything we do and everyone we care about. A recent report from Healthy Minds Policy Institute lays out what could be a very rocky road for Oklahoma's mental health. As 2 Works For You continues our Mental Health in Oklahoma series, I speak to an expert about how coronavirus is affecting us and help that is certainly out there.
This is just an unprecedented time. We have so much to process through.
Dr. Rebecca Hubbard knows the stress everyone is under during this COVID-19 pandemic because it's part of her job with the Mental Health Association of Oklahoma.
This is a traumatic experience for everyone. Any way you slice it, it has some level of trauma to it.
She says this pandemic is affecting everything that's important to us.
There's a few things people are really emotional about, right? Finances, their children, and health. This literally impacts all 3 of them.
That's why she's very worried about the mental health of people working from home or sheltering in place. She's not alone. A nonpartisan team of mental health experts working with state and local leaders has published this report on how COVID-19 could affect Oklahoma. The team says in the next 12 months, 30% of children quarantined could experience PTSD. Unemployment and financial stress will increase drug addiction and alcoholism, and 100,000 Oklahomans may experience suicidal thoughts, and 30,000 could attempt suicide.
Unfortunately, we have already seen some suicides in the community and some significant mental health challenges come forward.
Dr. Hubbard says recognizing the signs of stress is vitally important. This includes trouble sleeping or nightmares, tightness in your chest or a racing heart, and having trouble getting motivated to get out of the bed or doing something you love.
And you start noticing a pattern of every day you're not motivated, or every day you're snapping at the kids or overwhelmed, right? It might be a good time to reach out and just hear the other people in that group say, me too.
She wants everyone to know there is help out there, so don't be afraid to call.
You can even call and start counseling, brand new, on telehealth.
Whether it's one-on-one discussions, group meetings, or self-help, find what works for you and stick with it. Stay positive, because together we can get through this.
We can work to actually have traumatic growth, which means we experience a trauma, but we also develop adaptation and coping through that process, and we become resilient.
All right, if you'd like to see the report on how COVID-19 could affect Oklahoma, we have a copy with this story. You're going to find it on our website. If you need help, please don't be afraid to reach out. You can contact Mental Health Association Oklahoma by calling 918-585-1213. Plus, I've been doing Facebook Lives with Dr. Hubbard, with the association on our Facebook page. We do have another one coming up right after this newscast on the KJRH Facebook page.